So let us take a look now at the Philippine setting. How adaptive is the Philippines in using technology, not only in nursing, but of course in the field of healthcare? Okay, so this is one of the reports published by the Philippines in 2013. Okay, and as you can see here, we highlighted some of the most important. As we can see on this section, okay, RNs, gaano kadami ang registered nurses? So for every 10,000 population, 6 lang ang nurses. So ganun kakonti ang mga nurses natin sa Pilipinas. Okay? Kaya in demand kayo. Hindi kayo mawawalan ng trabaho kapag kahit may pandemic, no? Okay. Kaya nga ito yung kinatatakutan natin because, for example, if everybody caught COVID, so the health system will fail. Why? Because for every 10,000 population, there are only 6 nurses. Okay, so we need you guys. So if you're a Filipino, you expect that you will live for 69 years. That's the average. Okay, that's the average, 69 years. If you're a Filipino, the average life expectancy of a Filipino is 69 years. Okay, so sa akin, medyo matagal-tagal pa. Kasi I just turned 21 last year. Okay, I just turned 21 last year. Okay, hindi ka naniniwala. Natawa kayo dyan. Okay, pagbigyan niyo na ako. Okay, next. So, one of the outstanding, no? One of the outstanding and sabihin natin very revealing data is this. If you can see here, mobile penetration is 107%. Oh, sumobra ng 100%. Why? Because based on this data, mas maraming cellphones as compared with residents in the Philippines. Then that's true. Because for some of you, you maintain two cell phones, right? Diba? Pero ako, only one cell phone. I'm only using one cell phone. Yeah, because I cannot manage two cell phones at once. Okay. However, in terms of internet connection, so 36% of our of the residents in the Philippines have access to fast internet connection. And if we're going to take a look at the technology utilization in every industry, so we rank 98 out of the many countries in terms of information communication technology. Ayan. Okay. So yon. So again, you chat down notes while we are discussing so that you can highlight some of the things that might appear in your examination. Okay. So that is the Philippine setting. So at this point, let us take a look now. How are we going to define nursing informatics? Okay, previously we don't have the term nursing informatics. It started with what you call health informatics. Before, we don't have nursing informatics, but we have a general term we call health informatics. And when we say healthcare informatics, it refers to a discipline that combines the following factors. And what are those factors? First is computer science. Computer science refers to hardware. Okay? Information science pertains to softwares that are installed in our computer. Health science, this is the standard or the standards that we are using in nursing, because nursing is being driven by standards. Example, if you're going to inject something to a patient, there's a standard that we follow. If you're going to do bed bath, there's a procedure that we follow, and that is a standard. If you're going to administer a certain medication, you need to watch for the signs and symptoms. Yes, because we have standards in nursing. So examples of standards. Next, cognitive science is intelligence. When we say cognitive science, we are pertaining to intelligence from human beings, because no computer can function without human beings. Although we have artificial intelligence right now, just like Alexa, okay? So still, computers cannot function independently without human intervention, maybe prior or post development, no? And wisdom, when we say wisdom, we are dealing with ethics or morality. And that is an important part of technology use. Whenever we will be using technology in nursing, we also need to consider morality, the goodness and badness of human actions. Okay, so when we combine all of those, we are pertaining to health informatics. So this is quite general. This is quite general, no? However, in the 2000, in the year 2000, no, Um, the American Nurses Association advances the definition of nursing informatics. So meron ng field which is specific to nursing sa paggamit ng computers in the healthcare practice, and that is nursing informatics. So the American Nurses Association describe it as a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. So we want you to understand that when we talk about nursing informatics, we are not only dealing with computers, but we are dealing more on information, on how we can make use of this information to guide our nursing practice. Okay? So again, if you have any question, you can post it on the chat and we can answer anytime. Okay? So yun, that is nursing informatics. So this is what the book says. No? How about you, Dr. Dino? What is your definition of informatics? For me, we should we should not tire ourselves of memorizing different definitions, because the essence of informatics are actually in the word informatics, just like what we are telling during your orientation, right? Okay, the essence of informatics lies within the word informatics. So for example, when we talk about informatics, firstly, we need to deal with information, right? And nurses are encountering a lot of information from the patient, from the hospital, and from other things. Can you give me a sample of patient information? Anyone?
Science.
Vital signs.
History.
Very good. Health history, these are information. Vital signs, these are information. Anything that you can get from your patient, these are data that can be considered as information. So in informatics, information is very important. Next, not only information, but of course, we need to ensure that the information is reliable. We need to ensure that the information is reliable. And how do we do that? We check our devices if that's working properly, right? Because if you will not check your devices, you will get non-reliable information. Just like, for example, when I went to the bank, no? When I went to the bank the other day, okay, I was scanned. Of course, protocol, no? I was temperature scanned by one of the guards, and my temperature is 35 degrees Celsius. Okay, 35 degrees Celsius. I know in the US you're using Fahrenheit, but for the purpose of our discussion, we will be using Celsius at this point. So um, the guard scanned me, and my temperature is 35 degrees Celsius. Is that possible? Is that possible? 35 degrees Celsius? I'm not Edward Cullen. I'm not Edward. Although I look like Edward Cullen, but I'm not Edward Cullen, right? Beginning of class. Okay. So yun. So my temperature is 35 degrees Celsius. So I asked the guard, no? Sabi ko, guard, I think you need to recalibrate your device because it's not working properly. And that is dangerous, especially during this time of the pandemic. I'm not 35 degrees Celsius right now. Yun. Because according to informatics principles, you need to make sure that the information is reliable. And you can get reliable information by checking your devices, doing confirmation from your client, right? How old are you? When is your birthday, etc. So in informatics, we need to make sure that the information that we're getting from our client are reliable. Okay, next. If you're a nurse taking care in the hospital, it's not only you. Okay, right? So you are also working with other nurses. You are working with the doctors. You're working with nutritionists. Okay, you're working with LPNs in the US. You're working with DNPs, etc. So therefore, in informatics, it's not enough that we get reliable information, but nurses should also have the capacity and competence to manage information, right? Yon. So for example, when I was a student at the university, at the Lady Fatima University, we have duty at clinical duty at the Fabella Hospital. And in Fabella Hospital, the ratio of nurses is 1 is to 60 patients. So I'm handling a lot of patients on my shift, right? So therefore, I need to be good in management, in managing my data, in managing reliable data in the clinical practice. Okay, next, informatics deals with technology. And that is the earliest attempt to define informatics, the use of technology, right? So every nurse should be technologically competent. Not only technology, but of course, no computers can function without human intelligence. So you always need to use our logic as human beings, right? Next, um, you are not only the healthcare provider which is present in the hospital, so therefore you need to also communicate the data to other persons. You need to communicate the data to the doctor in terms of the assessment that you conducted, etc. So communication is important in informatics. And lastly, we are following certain standards. In informatics, we are following certain standards. So if you're going to ask me, okay, if you're going to ask me, what is my own definition of informatics? Informatics for me refers to the management and communication of reliable information using technology and human intelligence in compliance to standards. Okay? That is the management and communication of reliable information using technology and human intelligence in compliance to standards. So that is a definition that I coined way back in 2010. And this is being used by other nursing schools in the Philippines. Not only in the Philippines, but of course in abroad. Okay? So that is the easiest way for you to understand what informatics or specifically nursing informatics is all about. And if we're going to take a look at the history of nursing informatics in the Philippines, we are actually kind of slow in terms of adapting technology in the practice of the health professions. Just like, for example, our history in informatics started way back only in 1980s when the tertiary hospitals in Metro Manila are already using IBM computers. IBM, ito yung medyo archaic na computer. You have the disk. Ewan ko kung naabutan nyo pa yon. Naabutan nyo ba yon? Yung floppy disk. Kasi ngayon, flash drive o kaya cloud na tayo di ba? Pero previously, you have the floppy disk. Naabutan nyo ba yon? Floppy disk?
Elementary.
Yes,
Sir.
Okay. Naabutan nyo yon. Ako kasi hindi ko na naabutan yun eh. Naabutan ko na yung mga flash drive eh. Joke. Then, naabutan ko lahat yan. Yung tipong nagpa-programming pa, no? Nagpa-programming. So, abutan ko yan. So, the use of computers in hospitals in the Philippines only started in the 1980s. Then after that, there's this person who really want to advance the use of technology in healthcare, and that is Dr. Pame. Okay. Sorry, Dr. Marte. Dr. Marte initiated the organization known as the Philippine Association of Medical Informatics. So as you can see, informatics development in the Philippines, just like the global history, started with medicine. So in general, right? Then he established the Medical Informatics Unit at the Philippine General Hospital under the University of the Philippines, Manila. Then after that, they created an electronic health record that can be used in the in the community, specifically in the barangay area, and they call it the cheat system. What is cheat system? C, community, H, healthcare, I, information, T, tracking. Okay, cheat, community health information tracking system. So that is the very own health records that is being used in the barangay level. I'm not saying that all barangays in the Philippines have this, but they are disseminating this this health record. Now, instead of having that paper-based, they are using what you call the computer-based. Okay, and very Philippine-made community health information tracking system. Okay, don't forget that in your exam, there will be several abbreviations that you need to identify. Right? So for example, pag sinabi natin CHIT, what is CHIT? Community Health Information Tracking. Right? Pag sinabi natin, sabihin natin na PAMI, Philippine Association of Medical Informatics. What is IBM? International Business Machines. What is SMS? Short Messaging Service. Right? Diba? What is WWW?
World Wide Web.
Very good. World Wide Web. What is URL? What is URL? What is URL? Universal Resource Locator. Okay, you Google that if you cannot answer. Okay. Sige, URL, Universal Resource Locator. Okay. And of course, going back to our discussion, meron kaming trivia. Okay. Trivia. Did you know that the WHO tuloy, the Department of Health website was only launched in 1997. Yan. Before 1997, if the government in the Philippines has a specific program in health, usually meron silang commercial in the television, tapos mostly poster, mostly brochures, etc. Kasi wala pa silang website. Okay, and the website of the DOH started only during the 1997. Okay. By the way, what is the first website? What is the first website ever created globally? Okay? The title of the first website is Inquire Within Upon Everything. That's the first website that was created. Inquire Within Upon Everything. Okay, just nice to know information. Okay, but in the Philippines, okay, in terms of health, the DOH website was only launched in 1997. Okay, then after that, during the Ramos administration, President Ramos administration, the government has this agenda called IT21. And what is IT21? Information technology for the 21st century. That is the agenda that was started by uh, President Fidel B. Ramos in the Philippines. Okay, then after that, several years, Master of Science in Health Informatics was offered in the Philippines through the University of the Philippines. So if you would like to take your being informaticist seriously, you can take Master of Science in Health Informatics. Okay? Kasi, di ba, for example, you are a nurse. Most of the nurses are medical surgical nurse, pediatric nurse, community health nurse, operating room nurse, emergency nurse, etc. But if you are very good in technology, you can be an informatics nurse. Okay, they call it an informatics nurse. And going back to cheats, in 2004, they started distributing cheats to the barangay level. They started distributing cheats to the barangay level. Okay? So very short, no? Very short. Very short ang history ng informatics, of course, as far as the Philippines is concerned. Okay. So again, pag sinabi nating informatics, that is a combination of different sciences, no? And magpapakita ko sa inyo ng example. So I would like to show you the most handsome nurse that I met. Okay? Ito yung pinaka-handsome na nurse na na-meet ko several years ago. Okay? So, yan. This is when that handsome nurse visited Japan, no? Way back in 2009. Okay, way back in 2009. So, pag sinabi nating nursing informatics elements, of course, nandyan ang computer science. It refers to the hardware. Okay? Nandyan din ang information science, meaning those programs that are installed. And of course, you have your nursing science, the research data that supports standards of the nursing practice, cognitive science, and wisdom. Of course, we have nurses thinking, human intelligence, and of course, ethics at mind or wisdom, the goodness and badness of human action. Okay, so next question. If you're going to ask me, what is the best representation of the nursing informatics topic or nursing informatics course? And I will only tell you one thing. That is the electronic health record. Okay. In any situation, when we talk about nursing informatics, we're always dealing with the topic on electronic health records. And what are electronic health records? Okay, before that, I would like to show you a picture that I took several years ago in one of the hospitals in the Philippines. Okay, I will not tell you the name of the hospital for confidentiality, but itago na lang natin sa pangalan East Avenue Medical Center. Okay, joke lang. Joke lang. This is not East Ave. I am just joking. Huh? Okay, so I took this picture from one of the hospitals in the Philippines, not East Ave. Okay, this is just a joke. Okay, and as we can see here, The current scenario in the Philippines is we are using paper-based records, right? We are using paper-based records. Okay? Paper-based records. And it will tell you something. Whenever a person sees this scenario, okay, we have a problem. What's the problem? If the hospitals are still using paper-based records, okay, according to studies, laboratory tests that are written on or printed on paper are mostly lost and reordered. Another, nurses spend almost one third of their time not taking care of the patient, but they are doing charting and documentation because every now and then, whenever you do something, you need to record that. Another, so paper-based records are either missing or incomplete. 50% of that are either missing or incomplete. And majority of what the nurses are doing are not actually recorded in paper-based records. Can you please turn? Ah, slow. Okay. Can you? Yeah. Okay. Okay. So 30% of nursing interventions are not recorded. No? So 30% of interventions are not recorded. Okay. My pamangkin is here and he's playing computer games. Okay. So yun. So we have a lot of problems, no, as far as this paper-based record is concerned. However, in other countries, okay, they are using what they call the electronic health record. So electronic health record is simply the digital version of the paper-based records. And for me, this is better as compared with the paper-based records. Okay, just like for example, what are some of the problems that we are actually giving solutions, no? If we are using the electronic health record. So what are the problems of using a paper-based record? First would be, if you're using the paper-based records, some, of course, penmanships are not comprehensible and incomplete, right? Incomplete. Kasi ibang nurses tamad mag-record. Okay, next. Difficult to access in one place. Difficult to access in one place. That is true. For example, if the doctor is using the paper-based record, can you access it? No, because it's at the doctor. But if you will be using electronic health record, you will just log in with your username and password, and both you and the doctors can access it at the same time if you're accessing it at the same time. But that is not possible for paper-based records. Okay, next, not secured from unauthorized users on use or users. Okay, uses and users. Example, if you will be for example, watching telenovelas or Korean novelas, so similar to that, patient records are being stolen, okay, and the public will identify the diseases of the patient, etc. So simple, something like that. Okay, so electronic health record is one of the core topics in nursing informatics, and there are actually two types. There are actually two types. So I am going to show you the two types. So we have what we call the the usual no tradition the first electronic health record and the clinical information system. Actually, there are different terms that is being utilized, no? Medical record, electronic medical record, okay, medical recording system. So there are different nomenclatures that are being used, but they are actually similar. However, there are some big differences. For example, if we say electronic health records, this is a health record that contains the lifetime health status of an individual. And they do it at the national level. Example, I was born, for example, September 6, 2005. Okay. For example. Okay. So I was hospitalized at age 5. I was again hospitalized at age 7. I was circumcised at age 8, for example. So if the hospital is using electronic health records, you can access my data immediately. Okay? Because it contains my courses, no? I mean, all activities that I had for my health. And for me, that is better because it will save us time as nurses, right? Because usually when you work at the hospital, whenever there's a new patient, you always ask the status, mother, father, diseases from the mother side, etc. Where are you located? Where are you residing? How old are you, etc. We are asking those things. But if you will be using electronic health record, your records are there. And if there will be some changes in your journey as a healthy person, etc., so that will be included there. Even if you transfer from hospital to another, that hospital can access your record, your lifetime health record. So that is something which is permanent. So that is electronic health record or what we call EHR. However, there's a terminology that emerged recently, and we call it the clinical information system. So clinical information system is somewhat temporary. Okay, temporary. So it only contains data at one point in time. So for example, I was admitted at Fatima last week. So I gave my information, they collected my information, okay? And after I was discharged from the hospital, they're going to archive it. And they cannot access it in the future. So that is temporary. So we call it the clinical information system. So I'll be sharing to you two examples of screenshots, okay? And this is the electronic health record, okay? And this is the clinical information system, CIS. Okay, as you can see, electronic health record is more comprehensive as compared with the clinical information system, which is temporary. Temporary. Kapag na-admit ka sa hospital, they will capture your data. Okay, they will capture your data, and that is can be accessed only during your course in the ward. While electronic health record, so it contains all the information from womb, no, until to the present time. Okay, so question: what is the problem? Why are some countries not adopting the use of electronic health records or any medical record that is electronic? Because of the lack of resources. Okay. First, computers are expensive. You know that, especially for least developed countries. And number two, because of competence of the users. Pero if you are a graduate of Fatima, I'm very sure that you are competent in using computers. So you can adapt to any system that might be applied, no, or implemented by the hospital. Okay. However, there are some foreign organizations who created, no, they created electronic health records that can be used for free in other countries. Okay, and one of the examples of free softwares that can be used by the hospital is Open EMR or simply OEMR. By the way, guys, when you heard of the word open pertaining to software, what does it mean? Free. When we talk about software, when you heard of the word open, for example, Open EMR, it means free. So anyone can use it. So for example, do you have your Google Chrome browser? Some of you downloaded Google Chrome. Did you pay anything for it? No, because this is an open source. Okay, this is an open source software. Open means free. Okay, or technically, if you would like to have the technical term, we call it the floss. Floss. Sulat ko lang. What is floss? Free / libre. Open source software. Yon. Okay, floss. That is the technical term. Free / libre open source software or what we call the floss. Okay, the floss. Free, libre, open source software. Bakit libre? Is that a Tagalog term? Libre is not a Tagalog term. That is a foreign term that we get from the root from Spanish, no? Okay. So yon. So libre. Libre siya, open source software. So again, one of the examples of free electronic health records would be the Open EMR. Question, Why is the Philippines not adopting this? Because before you can use any software, you need to buy a computer, and that is quite expensive as compared with those capacities of other countries. Okay, so I'll be showing to you now some pictures of OpenEMR. Okay, don't worry, we'll do it by passing this time. However, in the future, we're going to have a laboratory for this one, a virtual laboratory for OpenEMR. Okay, so this is what OpenEMR looks like. Okay, OpenEMR. Okay, so guys, just for additional knowledge, before an electronic health records can be used by nurses in their practice, it should contain what we call the NMDS, or what you call the nursing minimum data set. Diba? Okay. So meaning these are the requirements as far as electronic health records are concerned before it can be used by nurses. So uh, for example, if you want to buy a cell phone, so you have your personal requirements. Okay, I want to buy a cell phone, but make sure that that cell phone has camera, that cell phone is a smartphone, that cell phone is bigger than the usual phone. So you have your requirements, right, before you buy something. So just like in electronic health records, before nurses can use it, every electronic health record should comply with the NMDS, or what you call the nursing minimum data set. It was actually enacted during the 1970s, and these are the set of features that are embedded on that software. Okay, tingnan natin. So this is an example of the screenshot of OpenEMR. For this, before this can be used by nurses, there should be an area that where nurses can input demographic elements, because we're the ones who are getting the demographic data of the patient. Next, there should be an area in that software wherein we can chart the patient's data or nursing care elements. And there should be a feature for that particular software that contains data input for other services of the hospital. Just like, for example, nutrition, dietetics, etc., pharmacy, billing. So these are uh, uh, service elements, no? Okay, so using this, OpenEMR is actually a breeze. Before, nung nagfe-face-to-face tayo, we actually have computer units at the virtual laboratory kasi may naka-install na OpenEMR. Example, ganito siya. So, syempre, may username and password. We'll do it by passing just to give you an idea. For example, there's a patient that is being admitted to the hospital. You can input the data of the client. You will not write it, but you will type it. And when you assess the vital signs of the patient, when you do review of the systems, you will not write it. You will just tick the button. For example, is there a weight change? Yes or no? Okay, eyes, is it, for example, are the pulses palpable? Yes or no? So you will just tick, no? So just like answering online surveys, similar similar to those things. Okay. However, personally, as an informaticist, I don't like OpenEMR because it's too complicated. Okay? What I love better is the OpenMRS. Mas gusto ko ang OpenMRS kasi mas maganda yung interface niya. Very chill, very cool, no? Maganda yung colors. Okay. So just like, for example, just like the OpenEMR, OpenMRS refers to medical record system, and this is also a free software. Okay? You type in your username and password. Okay? Then you can input or find the patient. Okay? Then after, you can input the data of the patient just like the OpenEMR. If that is a new patient, create a new patient, etc. Okay, recording options. So just to show you, but we will not be doing demo right now. Okay, pinapakita ko lang sa inyo yung features ng software, but we will have an activity 2 weeks from now with relates to this para masanay kayo kung paano ba gamitin yung mga OpenEMR na yan. Okay, so I like it better as compared with OpenEMR. Okay, and again, sa Philippines, what is that software that they develop for barangay at the level of the barangay level? What is that, guys?
Cheat.
Cheat.
Very good. What is CHIT? What is CHIT? Community Health Information Tracking System. Okay. And I actually undergo training for cheats under the UP Manila way back in 2007. Ako yan, ako to. That was me when I was only 12 years old. Okay, biro lang. Okay, so yun. So that is the cheats. Again, cheats refers to Community Health Information Tracking System.